Hi, for MyHealth project. In this video, we will present about the Needs and Capacity Report done by MyHealth project. What's the goal of the Needs and Capacity Assessment Report? The main goal of this report is to define the health needs and barriers for recently arrived migrants to Europe. We did this using focus groups, individual interviews, and surveys of migrants and professionals. This was conducted in 4 cities: Barcelona, Berlin, Brno, and Athens. First, let's look at the focus groups and individual interviews. 40 professionals and 64 migrants participated across all 4 locations. The main concerns that were most important for both groups were life conditions and how immigration impacts overall well-being, healthcare system relating to access and knowledge about the system they arrive to, and mental health such as anxiety, PTSD, and high stress. Now, on to the Needs and Capacity Survey. It is a survey of 285 professionals and 101 migrants about migration and healthcare services. Let's look at the background of the professionals who took the survey. 43% of the professionals were physicians, 27% were non-health professionals, and 29% worked in other healthcare-related roles. Now, let's look at the migrants who took the survey. 30% of them came to Europe from Asia, 28% from Latin America, 30% from Africa, and 6% from Eastern Europe. 36% of the migrants left their home country to escape violence, and 35% left for a better economic situation. Now let's look at the survey results. First, barriers. 94% of professionals said migrants face barriers to healthcare. The most common barrier is language. Next, healthcare system. 80% of migrants surveyed do not know how the healthcare system in their host country works. Next, mental health. Both professionals and migrants think the most common health concern for migrants is mental health. Finally, cultural competence. 70% of professionals said that they have not had workplace training on treating migrants related to cultural competence. So what are the next steps? First, bring cultural awareness and translation services into the healthcare system. Cultural competence trainings could benefit health and mental health professionals who work with vulnerable migrant and refugee populations. Next, make access to health resources easier for migrants. This is what programs such as MyHealth aim to do. Thank you for listening. Goodbye.